con él, pero bueno, vamos dando... ¿Qué fue lo que molestó, digamos, al doctor Hugo López-Gatell y a otras personas respecto de los comentarios hechos sobre México, sobre la respuesta mexicana al coronavirus por parte del doctor Eric Feigl-Ding?
Pues él mencionaba que lloraba por México porque decía que el 50%, digamos, la tasa no de contagio, pero digamos de datos positivos sobre las pruebas era superior al 50%, y mencionaba que aún ni en los peores momentos de Nueva York o Italia este dato era tan alto. El sábado...
O sea, 50% es que una de cada dos personas a la que le hacen la prueba resulta positivo,
Exactamente.
¿no? Lo cual es francamente muy alto. Creo que ahora sí lo tenemos en la línea telefónica.
Eric, how are you? Thank you for taking this call.
Thank you.
Thank you very much. And first of all, we want to know what is your view and why you raised the alarm in the case of Mexico with the high rate of positivity cases.
Yeah, I've been watching this epidemic for a very long time, ever since January. And I tried to raise the alarm before in January, but world leaders and a lot of policymakers did not heed the warning. And so ever since, I've been trying to actively engage and raise the alarm whenever there is some signal that a country or a city or region is in trouble. And I've been doing that a lot. And so when I saw the data from Mexico with 56% positivity according to our world in data, it was very alarming, and people need to know about it. And especially seeing how low Mexico's testing is, it is extremely worrisome. And so I felt people really need to know, especially with the risk of public health.
Bueno, voy a traducir rápidamente. Dice que él ha estado observando desde enero la situación de la pandemia. Dice que los líderes mundiales no le hicieron caso y que cuando vio que en México el índice de positividad estaba en 50%, pues le pareció muy alarmante. Eric, I would like to ask you, how relevant is testing? And this morning you tweeted that Mexico is only taking tests from 1 in 12,900 people. How low is this compared to other countries? And also how important is testing?
Yeah, so testing is enormously important, and I cannot stress it enough. First of all, Mexico's testing of 1 in 12,000 people is extremely low. And even when you compare that to every other Latin American country, it is among the lowest. And with that, it's actually decreasing over the last few days, actually, according to the latest data. So if anything, Mexico needs to test more. And testing is so critical because early testing is what allowed South Korea, to stop the epidemic. It's not just how much testing, but when you do the testing. And early testing and as much testing as you can helps identify the cases, quarantine them, find who their closest contacts are. That's called contact tracing. Quarantine them and isolate them. And this traditional testing, contact tracing, quarantine is the formula used to stop epidemics around the world before they have vaccines. And that's how we stopped the original SARS epidemic in 2003 without a vaccine. But here we are, not doing enough testing, and every country that has not done enough testing has suffered terribly. And that was why when positivity starts growing that high, which is a proxy measure for the extent of an outbreak, you know there's inadequate testing and the epidemic is growing. And that's why I really wanted to raise the alarm.
Nos dice Eric que es muy importante el realizar pruebas, que en México es muy bajo aún comparado con América Latina y que incluso ha caído en los últimos días. Y las pruebas son muy importantes. Vemos el caso de Corea del Sur, en donde detectaron, no solo es, además nos dice, cuántas pruebas, sino cuándo las haces, que eso también es otro componente importante, porque eso permite hacer cuarentenas, el contacto, la trazabilidad del contacto, esto que se conoce como contact tracing, y por supuesto la cuarentena sobre los contactos. Dice que los países que no han hecho pruebas han sufrido, porque esta es una aproximación, digamos, que nos da una idea de la pandemia. Eric, what is your perspective in the case of the answer that Hugo López-Gatell, the technic here in Mexico, the one who is in charge of the answer of Mexico against COVID, and he has said that testing is not important, the number of testing, and that the approximation of Mexico is different because they are taking in account the hospital capacity, etc. What's your opinion about this kind of focus on in terms of facing COVID-19?
His comments the other day, I think were pretty polite to me. It was very professional, so I respect how professional his answer was. And I professionally disagree about that the testing approach, relying on just testing of people who are very sick or in hospital, is enough. Because hospital, only a small number of people get hospitalized, and by small I mean 1 in 5 or so. But the thing is, the 80% of people who have mild symptoms, and oftentimes are not being tested, right? And we know that they are still spreading it, and up to 20 to 50% of the population, 20-50% of people with COVID actually have no symptoms at all. The problem is they will keep spreading the virus. If you do not find them, they will keep spreading it. And if you don't test those with even mild symptoms, or I'm not even saying to test everyone across the population, if you don't test them early, you won't be able to stop it. Testing early will stop it. And so his answer of testing only people who have severe symptoms or are hospitalized is not nearly enough, because by the time you test and realize you have that, you're already 3 weeks behind the epidemic curve, and it does not help stop the epidemic because it is too little, too late. Hope that makes sense.
Bueno, nos dice respecto de la respuesta de Hugo López-Gatell que sus comentarios fueron educados, cordiales y profesionales, y le agradece eso, pero que está en desacuerdo con que se aplique solamente pruebas a personas que tienen síntomas y a tener como objetivo el número de personas hospitalizadas. Nos dice que el 80% entre el 20 y el 50% de quienes tienen la enfermedad no tienen síntomas, y que si no se les encuentra van a seguir contagiando a otros, y esto no va a servir, este tipo de estrategia no va a servir para detener el contagio. Eric, so Mexico is testing 1 in every 13,000 about. How many people should Mexico be testing in comparison with this figure?
A number of testing volume depends on how severe the epidemic you think it is as well. Just so you know, the positivity in South Korea during their epidemic, they were testing enough that only 2% of tests were positive, 2% positivity rate. And in Iceland, they were testing enough that only 0.5% of all tests yielded results. I'm not saying Mexico has to equal Iceland or South Korea. It must improve to at least the testing volume of say, Chile and many other countries. And on the graph that I posted, you will actually see that Mexico right now is testing way, way below per capita than almost all these other Latin American countries. And so I think Mexico needs at least 10 times more testing volume than it has right now, or else it cannot stop the epidemic. We're always playing catch-up. If you play catch-up testing of people who are hospitalized, you'll never win an epidemic that way. And we want to win the epidemic, not just to prevent people from overloading the hospitals, because, you know, we care about prevention, not just, you know, making sure they don't die. That is not public health.
Nos dice que, le pregunta a Pascal que justamente cuál sería el nivel óptimo de México en términos de realizar pruebas. Nos dice que, por ejemplo, en Corea del Sur, el 2% de las personas que les hicieron la prueba sale positivo, lo cual nos habla del volumen, e incluso Islandia, en donde es medio punto porcentual, nos dice que una buena aproximación es, por ejemplo, Chile y otros países, pero que, bueno, en el caso de México es mucho menor. Dice que al menos debería ser 10 veces, porque de otra forma te dedicas a tratar de atrapar la epidemia, pero pues simplemente no se puede ganar y no se puede controlar simplemente en cuanto a la capacidad hospitalaria. Eric, the data that is more, that maybe we can trust a little bit more here in Mexico is about the people that has died because COVID. What that tells you in terms of the evolution of the COVID-19 here in Mexico? Right now, the data from yesterday was 23,377 people died for COVID. What is the diagnostic that you can have of the pandemic in Mexico with the death data?
First of all, the death data is only as good as your testing. Because if someone dies without COVID testing, unless you're counting total excess deaths, which is another good way, but unless you have testing, you won't know whether a certain death is COVID death. So first of all, I want to highlight that the COVID death data is only as good as testing. And secondly, you can actually see that compared to other countries, Mexico's death rate is much higher than its incidence rate. It's going up.
Perdimos la comunicación, vamos a restablecerla. Pero bueno, le preguntaba a Rodrigo cuál es su diagnóstico de acuerdo con los datos oficiales, y él decía, bueno, pues que los datos de las muertes solo son tan fiables como las pruebas que se están aplicando. Y bueno, nos estaba diciendo también que comparado con otros países, la tasa de muerte es superior comparado con el número de casos. Sorry, Eric, we had a short break in our communication, but please go on.
Yeah, so I think the testing, we know from the testing when the mortality, that the mortality right now is much higher than other neighboring countries. And its incidence, but it's much lower than many other neighboring countries, which means we're not capturing cases fast enough. And I think the best way right now, if you do not have enough testing, is to not just look at the COVID deaths, tested deaths, but to look at total excess deaths. How many total people are dying above your annual norm this season in June and May? You know, what is the total deaths? And I think that will give you a better capture sense of total impact of COVID. And that's what they're doing in many other countries, that sometimes we don't have enough testing, but if you look at total deaths, that tells you how bad the epidemic is. And I think without enough testing, Mexico should focus on total excess deaths right now.
Eric, we have to take a break now. It lasts like 2 or 3 minutes. Could you please wait on the line and we'll finish this conversation?
Sure.
Thank you very much. Bueno, vamos a una pausa y regresamos para continuar esta conversación con el doctor Eric Feigl-Ding sobre el coronavirus en México. Volvemos a seguir. Estamos platicando con el doctor Eric Feigl-Ding, quien es epidemiólogo y economista de la salud de la Universidad de Harvard, y él, pues en la respuesta que nos dio antes de irnos a corte, nos estaba diciendo cosas muy importantes que, bueno, por un lado, que los datos de los fallecimientos solo son tan buenos como el número de pruebas que se aplican, que México pues tiene una tasa de mortalidad más alta que otros países vecinos, y que lo que tendríamos que estarnos fijando, Rodrigo, es en las muertes, digamos, en los fallecimientos excesivos que se han dado en estos días de COVID comparados con los que se daban en años anteriores.
Eric, we have seen, for example, the case of Brazil that also has done very little testing. What would you say is the outcome for Mexico? You were telling us that the countries that don't do testing tend to suffer more. What will be your projections in terms of Mexico? We don't want that so technical because I know it's a very technical answer, but what will be the landscape for Mexico, taking into account that we are not doing enough testing?
Yeah, I think testing is part of the epidemic control. Obviously, social distancing rules, lockdowns, whenever the epidemic rages out of control too much, and key thing is mask wearing. So when you look at all these things together, all three of these are important, especially when the epidemic is growing. And Brazil, obviously, is also having a really bad epidemic. Bolsonaro is basically ignoring all the public health demands for any distancing. And the judge today in Brasilia actually imposed a fine. Basically, if he does not wear a mask in public, he will be subject to a fine, a daily fine. And I think that also shows very poor leadership, because our leaders need to be honest with people that mask wearing is important, testing is important, and distancing is sometimes important as well. But if you cannot distance and close down businesses, which is difficult, then everyone needs to wear a mask. All these things we need to do together in order to stop this epidemic. And this is just basic public health science, and we want to save lives and stop the pandemic. So we all need to do it together.
Bueno, le pregunta Rodrigo al doctor Feigl-Ding cuál es su perspectiva de qué es lo que está enfrentando México en función de que no está aplicando las pruebas. Y dice, bueno, las pruebas son una parte, pero también es importante el distanciamiento social, también son importantes los cubrebocas, los tres son importantes. Y pues nos refiere que en Brasil un juez le impuso una multa al presidente Jair Bolsonaro por no usar un cubrebocas. Dice, eso demuestra un liderazgo muy pobre. Los presidentes pues deben mostrar a la población que utilizar el cubrebocas, aplicar pruebas y el distanciamiento social son importantes. So, Eric, you think a president should be wearing a mask in public?
Yes, I think they should be wearing a mask in public, especially indoors. Outdoors depends on the people. At a press conference, obviously, if you're speaking, make sure you maintain distance. But normally, when you're close to people, you should definitely wear a mask at all times. And it also sends a signal to the public that mask wearing is important. It sends a signal that people should mind the epidemic. There is a raging epidemic going on. Please do not pretend these are normal times. And again, if everyone wears a mask, if 95% of the people wear a face mask, a simple cloth mask, we don't need to shut down the economy. We can show that we can bring this epidemic down to controllable levels. But this is why leadership is so important. And testing so that we're honest to ourselves that there's not an epidemic going on is equally important. Because if you ever watched the movie Jurassic Park, would you go to a Jurassic Park if you knew the dinosaurs, the velociraptors are roaming there? No. People do not want to go out and do not feel safe until we have enough testing that we're honest to people. The epidemic is slowing down, and that we are wearing masks, that we protect each other. And that all comes from the top, and I hope Mexico will help solve this epidemic for itself and the world together.
Thank you, Eric. Bueno, yo le preguntaba que si creía importante que un presidente use un cubrebocas en público. Dice sí, sobre todo cuando está en el interior, no tanto cuando está en el exterior, o si está en una conferencia de prensa puede guardar distanciamiento, pero es importante que un mandatario, que un presidente envíe un mensaje de que estos no son tiempos normales, y toma el ejemplo de la película Jurassic Park. Dice, la gente pues no va a ir a ese parque jurásico si sabe que hay velociraptores sueltos. La gente entiende perfecto cuando hay peligro, pero pues los líderes deben ser honestos con las personas. Eric, it's been great to speak to you. We really appreciate taking our call.
Yeah, thank you. Best wishes. Stay safe.
Thank you very much. Gracias al doctor Eric Feigl-Ding, epidemiólogo y economista de salud de la Universidad de Harvard. Rodrigo.
Pascal, pues interesante y sobre todo el dato que da, si el 95% de las personas utiliza cubrebocas, no necesariamente tienes que apagar a la economía, algo que en los países como el nuestro, como Perú, como Brasil, es particularmente imposible, ya no digo doloroso desde el punto de vista económico, y pues aquí vemos que no hacemos ninguna de las dos cosas. Es decir, son tres, ¿no? Que nos mencionaba. El tema de la distanciamiento social, que México lo ha hecho, no de manera forzosa, es decir, no hay multas ni nada. Dos, la realización de pruebas, que es la piedra angular. Y tres, el utilizar cubrebocas. Y lo que vemos de las autoridades federales de salud es que no se promueve el uso de cubrebocas y tampoco las pruebas.
Bueno, pues bastante caro sale eso. Rodrigo, gracias.
Gracias, Pascal.
Ha sido una entrevista muy interesante la que le hemos podido hacer al doctor Eric Feigl-Ding de la Universidad de Harvard. Gracias, Rodrigo.